I just want to soak up the sun. And this relates to my presentation on melanoma skin cancer, because if you're going to soak up the sun, like the people in this video, you should put sunscreen on. So again, my name is Jenner Sapienza. I'm a fifth year at Cal Poly. I'm a kinesiology major, and my presentation is on melanoma or melanoma skin cancer. So we have a patient. She's a 45-year-old female, and she's coming in complaining of a mole on her neck that has begun to suddenly itch constantly. After further questioning, we find out that a 45-year-old female is arriving to the clinic speaking of itchiness on a relatively new mole on the back of her neck. She explains that she first noticed the newer mole 3 months ago. The itchiness, redness, and swelling has progressively worsened over the past 4 weeks, or about a month. This irritation radiates around this specific mole on the neck, on the skin of her neck, which she describes as the most irritating itch that she's ever had. And she rates it on a scale of 1 to 10 at a 4.5 of pain. So definitely irritating enough to want to go and fix it, but not so excruciating that it stops all of her daily activity. She reports that her newer mole has continually changed over the 3 months that she's been observing it. It has an odd and irregular shape with rugged borders that is slowly increasing in size, is slightly raised above the skin, and now itches nonstop. All of her activities of daily living can still be performed, but her attention span and quality of sleep have significantly diminished because she's constantly fighting this urge to itch her neck at all times of the day. She's also very worried about this mole and her mental health, as she has begun to suffer from her constant worrying. She's tried anti-itch cream, such as Benadryl and cortisone. These only provide a temporary relief and sometimes do not help at all. No other medications that she's tried has helped, and there are no other remedies that have worked. So our patient's history. She really enjoys spending time with her husband, 2 children, and her dog, and she loves being outside hiking in the hills of California. She does not always wear sunscreen, though. Her family, her mother was diagnosed with breast cancer at age of 43, and this was successfully removed. Her father was diagnosed with non-melanoma skin cancer, because not all skin cancers are as deadly as melanoma, at the age of 50, and this was also successfully removed. Her grandparents simply just died past of old age. Medical history. She takes a daily multivitamin and iron supplements to combat anemia. She takes no prescribed medications, and her only prior surgery was her wisdom teeth removal at the age of 19, which was successful. So discussion questions. Based on the patient's subjective 2 slides ago, which of the following descriptors most strongly indicate symptoms of melanoma skin cancer? You can choose more than one correct answer here. So I'm going to have you guys pause the video if you need to. And here are the 4 choices. Constant pain of 4.5 out of 10 for 2 or more weeks. Attention span that decreases dramatically, a relatively new mole that has continually evolved, or a raised mole. Again, please pause and then resume once you're ready, because I'm going to move on to the next slide, which gives the answer. So based on the patient's subjective, the most strongly indicative symptoms of melanoma skin cancer are going to relate to the mole on the side of her neck, obviously. So a relatively new mole that has continually evolved, and also a raised mole. And we'll go into why these symptoms and signs are so indicative of melanoma skin cancer right now. So melanoma skin cancer, by definition, is a type of uncontrollable cell growth with the ability to spread, hence cancer, beginning in the cells that give the skin their pigment, or the melanocytes. That's why it's called skin cancer and not just any other type of skin cancer, because in the melanocytes. Breaking down the name by prefix and suffix, melan or melano refers to dark or black and is a reference to these melanocytes that give our skin their pigment. And then oma is actually a misnomer. Oma usually means it's a type of benign, mostly unharmful local growth or tumor, but melanoma is not benign, it is malignant. Other names, there aren't really that many other names for melanoma, but it can be referred to as malignant melanoma, cutaneous melanoma, or just skin cancer. But melanoma is a very specific type of skin cancer. So when looking at skin cancer, there are associated and typical symptoms following the A, B, C, D, and E's. A stands for asymmetrical. So when one half of the mole is not equal to the other half, as seen on the right side is looking a little bit more oblong, like a football. B stands for borders. If it has a jagged or uneven border, that could be indicative of an odd mole that you should go get checked out. Coloration, non-uniform coloring of usually shades that are normal to the skin, but again, it's usually uneven shading of it. So it could be black, brown, or white, or even a little bit of red that you can find on the skin, but it's this uneven coloring that's not one solid color like a mole normally is. Diameter, this is the one that you don't want to follow quite as well because it's not super indicative of melanoma, but larger than 6 millimeters across of any type of mole, you definitely want to go to get checked out. But melanoma is often caught at much smaller diameters than this. And then finally, the most indicative symptom or sign is an evolving mole or freckle. It's a continual progression of any of the first 4 signs that I described, and it would be the gradual progression of this, including itching, redness, swelling, and oozing, which our patient does have. So after physical examination, the patient's going to dress up in an exam gown, and then we're going to examine the entire body with this little microscope device that the doctor has in the photo here. We're going to focus on any area of interest. But again, we're going to look over the whole body and check for the A, B, C, D, and E's using microscopy or dermoscopy. We're going to ask them questions about their diet and their water intake, also about what they do for exercise and how often do they do it, and if they apply the proper protection, such as sunscreen. Then also talk about their family history of cancer. So observable, you can find the border irregularities, asymmetries, and color variation. Physically, you might find the raised freckles or moles, or if the area is hot, inflamed, itching, or oozing. And then further examination, you may order imaging later. You may order a biopsy to test the actual mole, or you may consult another medical professional. If you do ask for imaging, the best one for melanoma skin cancer would be a PET and CT scan combined. So the PET scan inserts a slightly radioactive sugar dye into the bloodstream. And this radioactive sugar dye identifies high metabolic rates in the body. And so cancers have a higher metabolic rate than normal skin cells. And so this sugar radioactive dye will actually be at a higher concentration where there are areas of cancer growth. CT scans or computed tomography distinguishes soft tissues. So it basically sends a bunch of high doses of x-rays into the body, which can be dangerous, and comes up with cross-sectional slices. So when you combine these two, you get the photo on the right, which is basically cross-sectional imaging of radioactive dye in the body. And so you can look at the highest radioactive areas of the body to see if that's indicative of skin cancer or cancer in general. So treatment by stage. There are 4 different stages of cancer, and I'm not going to go over every single treatment option, but basically you go from basic options such as topical surgery, excisional biopsies, and Mohs surgery, which I'll go over later, to using creams and radiation therapy. But then as you go down the list and the cancer has progressed further, you're going to get into more chemotherapy and immunotherapy. We're going to focus on 2 different surgical treatment options. Option 1 is the Mohs surgery. This is much less invasive. A trained dermatologist or surgeon will perform this, and you're going to remove layers one by one and keep examining the layers to see if the cancer has been taken out or not. It is a long process and it takes many hours, but here's a photo of how you'll go through the different layers until hopefully the skin cancer is removed entirely. Option 2, lymph node dissection. This has to do with later stages of cancer as it metastasizes. Ideally, it doesn't metastasize, but as it goes through the body, it'll go to the lymph nodes, which means that it's a more invasive treatment option. You're going to remove all the lymph nodes near the cancer site to slow down the spread and hopefully to prolong the life and see what stage of cancer is at. There are a lot of lymph nodes in the neck area, and because our patient came in with a neck mole, that's why I provided this photo here. Finally, there are some interesting facts. So melanoma skin cancer is not the only type of skin cancer. It's actually the least common type of skin cancer, but it is definitely the most deadly. So that's what is shown on the pie chart here. And then there is a high correlation between sunlight exposure and skin cancer occurrence. So as you can see in the red on this US map, there's a lot more skin cancer in areas where there's a lot more sunlight throughout the year constantly, such as Nevada, Arizona, New Mexico, Colorado, and California, and even Texas. So thanks for coming to my presentation today. Here are my references. I have a lot of them because it took a lot of research. But yeah, if you guys have any questions about melanoma skin cancer, please feel free to shoot me an email because I think it's really interesting. But yeah, have a good rest of your day and apply sunscreen.